Okay, welcome everyone for today's topic. Um, Today is all about diabetes, communication, relationships, and your sexual health, and how that can all be affected when you're living with diabetes. And just a disclaimer that I'm not an expert in this area, but this content was created by a previous social worker that worked in our program, and so I am taking from all of that great work and information to present to all of you today. I'm a kinesiologist and clinical coordinator, cardiac rehab supervisor here at UHN's Toronto Rehab program. So a few ground rules for this session. These sessions are for education only, and it's good to ask your own healthcare provider for any specific advice about your situation. If there are any questions during this session, you can use the Q&A box, which you can find on the Zoom toolbar, which you should find at either the top or bottom of your screen. And you can type in questions there that I can answer at the end of the session. So for this session, we are going to talk about ways to better communicate with your family, especially living with a chronic disease. And I apologize, I have a typo on my screen here for number 2. Instead of feeling comfortable returning to sexual activity after a heart event, we're going to talk about how diabetes affects your body and the different systems of your body, which end up affecting sexual intimacy and function, and how certain medicine can affect your sexual function as well. And so something that we would like you to think about after this session, an action item or something to focus on is we hope that you can come away from this session and be able to talk to your partner about how you're feeling or any specific concerns that you might have that you want to go over. Okay, so why is this information important to me? So healthy relationships in our lives are important. It's important that we have a sense of trust and intimacy with others in our life. And sometimes this can be affected when we're having to live with a chronic disease as well. It can create stress, burnout from focusing on your chronic disease. And so having that good support network around you, family, friends, people that you can trust, feel close to, is all a part of living well with chronic disease. So a few tips on how to communicate well with your family. If you are feeling stress or feeling worried about anything with your disease, it's important to be clear and specific when you're explaining how you feel with your family. We can't expect our family to read our minds and know exactly what we're going through or what we're feeling. So it's your job to be very specific and explain that to your family. Also to be specific in asking for what you want. So again, not assuming that everyone knows what you want or what you need in that moment. And so making sure that you're clear in asking for that. And then know where to get additional help. So either from a social worker, psychologist, your family doctor is a great resource, as you know, you can book appointments with your family doctor if you just need to talk about something or something is worrying you or causing stress. That's also a great resource that is free. These other social workers, psychologists, sometimes there's a fee associated with that, depending on where you're accessing those services. So in terms of sexual intimacy, again, same guidelines apply. So making sure that you're talking to your partner about any concerns or worries that you might have, or if you're noticing changes to your body due to a chronic disease, have that open dialogue with your partner. Also talk to your doctor. There could be different things that your doctor can help you out with. Look into, prescribe different medicine to help you out if there's any concerns that you might have. And so it's also important to learn how diabetes affects your sexual function, and we'll go over that in the next few slides. just to have that knowledge and know that, you're not alone, that certain conditions might be very normal when you're living with a chronic disease. And also to learn how your medicine can affect your sexual function. And so learning about the side effects. Okay, so how do I talk to my partner about sexual intimacy? So a couple of tips here. Listen to and understand each other. So taking that time to listen to each other's concerns, reflecting and really making sure that you can understand where the other person is coming from. Be clear with your communication and talk about what your needs are, what your feelings are, even what your fears are, and just being able to be vulnerable and get those things out on the table can make a big difference to help with the understanding. And then you can support each other by normalizing the different feelings that are described, to not be judgmental against your partner and just being able to listen and take everything in, and then working together to problem solve and figure stuff out if there's anything that is a concern within your relationship or a concern related to your sexual intimacy. Okay, so there's a few ways that diabetes can affect different systems of the body and which end up affecting sexual intimacy. So for one, it can cause lower testosterone levels, which will affect or can affect the desire for sexual intimacy. Diabetes can also cause nerve damage and affect blood flow. And so that will affect sensation to sexual organs and function as well if blood flow is limited. Living with a chronic disease, especially diabetes, is very common to have depression, anxiety, and stress as well. And all of those things can affect your level of interest in sex. And so that part is very normal and is something that you could work through with your partner and with help with your doctor, social worker, psychologist. As well, different hormone systems, so menstruation and menopause also affect diabetes and differing levels of blood sugar, depending on what part of your, for those who menstruate, what part of the monthly cycle you're on. Different fluctuating hormones affect blood sugars up and down. And then also when you're going through menopause, and again, your hormones are fluctuating, that can affect blood sugar. And there's a really great webinar on from Diabetes Canada. So if you go to their website, diabetes.ca, and just in the search bar, you can type in sex and diabetes. And the webinar should be one of the few items that pop right up. And that one the webinar is given by an endocrinologist and does a really great job of explaining how the fluctuating hormones can affect your blood sugar. Okay, so how does diabetes medicine affect your sexual function? So for people with a penis, certain medicine can cause erectile dysfunction, as well as just the way that diabetes is affecting your body. As we mentioned, with blood flow can create or cause erectile dysfunction. And then the medicine that can be used to treat erectile dysfunction can also affect blood pressure. So that's important to keep in mind as well if you're also on medicine to manage blood pressure, which is quite common if you are also living with diabetes. For people with a vagina, then you're more likely to experience vaginal dryness due to some of the medicine. As well, yeast infections are much more common because certain diabetes medicine takes the sugar out of your blood, and so that you can pass the sugar through your urine, through your pee. And so by having more sugar in your urine more often, that can lead to having a more higher incidence of having yeast infections. So just something to watch out for, to be mindful of. And make sure you talk to your doctor if you're experiencing these side effects from the medicine. And there's usually ways around it or adjustments with medicine that can happen to help with these side effects. And for all, if you are on using medicine for blood pressure, again, that can affect how you may perform during sex. So that just to be aware of that. And then any medicine that you might be on for depression can also affect desire for sexual intimacy and interest. So again, many of the medicine that you're on is very important and necessary to help manage diabetes or blood pressure. But still important to talk to your family doctor if the side effects are, having a big effect on your quality of life as well. Because as we said, having a good relationship with a partner, if that's something that you want, that's a big part of living well. Okay, and for more resources, don't forget about diabetescollege.ca. You can find the printed guide that you can download or go through chapter by chapter. And there is a whole chapter on sexual intimacy if you'd like more information. We also have under our Feel Well category of Thrive videos. There's one on sleeping well, which can help to manage stress. There's a video on strengthening your social relationships, and that one refers to some sexual intimacy as well. And then how to manage depression, stress, and burnout. So lots of great tips within those videos. And as well on through diabetescollege.ca. So the MyDP, so my virtual diabetes program is now live on this website, so you can check that out. And you'll find information about, if you are enrolled in the program, information about your program and the program manuals that you can also download from here as well. And then the link on the left for live education sessions is where you can find any upcoming sessions and also archive sessions. All right, so thank you for joining us for today's session. And a reminder that the next session will be Tuesday, April 21st at 2 p.m., all about how your heart works. And this is presented by Dr. O. Okay, thank you for joining us for this session, and have a great day.